Hello everybody, welcome, thank you for tuning in. I'm Dr. Smart with Smart Skin Dermatology, and today we're talking about Coolsculpting. So, Coolsculpting or cryolipolysis is a very fascinating technology that focuses on freezing fat. It exploits the concept that fat cells are more sensitive to cold injury than other cells of the body, nerve cells, skin cells, muscle cells. So you can take an area of the body with a approved, tested, and proprietary device, and you can cool that area down to the point where it's freezing the fat cells and they end up going through programmed cell death or apoptosis and will get cleared away by the lymphatic system. So you're shrinking an area down by causing the fat cells in that area to die off and get cleared away without causing damage to the skin, the muscles, the nerves, and everything in the surrounding area. Now, this is maybe obvious, but it needs to be said. This is not something that you can do at home. This is not something that you can do with any device. All the other cells in the body in the near area are and will die off with cold injury or cold damage, but you can do that with proprietary FDA-approved devices that can safely get fat to go away in a totally non-invasive fashion. So, freezing fat away. Who's the ideal candidate for this? Now, the ideal patient for Coolsculpting is someone who is already close to body weight. One of the misconceptions about Coolsculpting is that it is a weight loss technique. That is not true. It is a body sculpting technique. So, the ideal candidate, someone who's already relatively close to their ideal body weight, but they have an area or two that is a little more prominent. There's a little bit more fat there than they'd like it to be, and they'd like that to be smoothened down or brought down a little bit. Coolsculpting can do this very well. The downside to Coolsculpting is that you might need more than one treatment. It's totally non-invasive, so different people respond differently. Some people with one round of Coolsculpting on a zone do extremely well. The fat cells die off in a good percentage, and the body clears them away, and aesthetically it looks wonderful. But then there are other people that need that area treated a second or maybe even a third time. So, big picture, there's a lot of details and much more to talk about. But the ideal candidate for Coolsculpting is someone who is okay with a slow and steady method of removing or sculpting down a defined spot on their body that is a little bit more prominent from fat, and they are already close to their body weight. Not trying to lose large amounts of weight, but trying to sculpt a defined area of the body. And they don't mind the inherent risk of it being a little variable in result. Will one treatment be great? Very possibly. You just have to wait and see. Give it 3 or 4 months at least before you start making that decision, or you're doing multiple treatments on the same zone to bring that down. So, that's the ideal patient looking for Coolsculpting. It's a phenomenal technology. It's an incredible device, and we've done it, thousands and thousands of times now.